to get in this.
Sit
Sit down. Make yourself at home.
Thank you.
The doctor will be in momentarily. Do you guys want any coffee or
No,
water?
thank you.
No, thank you.
Okay. Hi, my name is Mrs. Green. I'm your nurse, and
I'm Dr. Loera, and I'm here to talk about your reproductive issues. I want to tell you the options you have in order to have a child. Since you aren't able to have a child the old-fashioned way, there is an alternative option called in vitro. Nurse Green will explain all the pros, and I will explain all the cons.
First, before I start talking, why should we have a baby and have trouble of going through that instead of just adopting one?
Well, adopting is a great alternative option, but that's for you to discuss. It's your right. You can discuss it after the session is done.
let me begin with the pros about in vitro. It is less invasive procedure than other fertility options that you might have. It gives hope to couples like you, so you can have babies finally, and eggs can be frozen if you decide to have another baby later on. It helps you save eggs as you get older, so you can have another baby, so you can have them older. Okay, and then birth defects are eliminated, and it increases success rate.
Nurse Green has explained some very good pros, but there are also cons to this procedure. There are risks for the mother. Women who are taking fertility drugs develop ovarian hyperstimulation syndrome, or OHSS. The fertility drugs directly affect the ovary, overstimulating them to produce multiple eggs. Also, this may cause multiple births. According to Colorado Reproductive Encourageability, IVF has a chance of producing multiple births. When fresh donor eggs were used, the multiple pregnancy rate exceeded 42%. Women who use donor eggs are older population, and women over 35 endure elevated complications rates during pregnancy. And last, there's also a danger to your baby's health. A Central Disease Control study has found that babies born from in vitro fertilization are twice more likely to be born low weight than regularly conceived babies.
So, before you start talking, is that going to be if you have the baby too early, is that going to be unhealthy for the baby?
It's gonna be. It may be unhealthy for the baby to have this procedure done. It won't be able to come out early, but it may have birth defects. You can have more time to discuss this. We're going to leave for a few minutes. You can discuss it while we're gone, or when we get back, you can. When you leave, you can discuss it at home in case you have any more further questions. Here are some pamphlets that will describe what may happen, and Nurse Green will give you our business card in case you need to call about any questions.
Yes. Just call this number anytime you have any questions, and we'll be sure to answer them. And you can also schedule appointments for the doctor's office, or even doctor procedures. So
you can discuss it for a few more minutes, and we'll be back.
I think that we should go home and discuss this. We'll tell the doctor, but I think it's a risk because it might hurt you or the baby, and I think we should think about it at home and discuss the rights and wrongs and what's going to happen.
Well, I think it's a great idea to have a baby because I think nothing's going to happen.
Something might happen. Doctor.
Yes?
We've discussed that we want to end the discussion. We'll discuss it at home and we'll be back in a few days.
Okay. So let Nurse, I'm gonna leave right now. Let Nurse escort you out. Nurse Green escort you out, and I will see you in a few days.
Hello. So, you're gonna come back in a few days. So, we'll be ready for your comments then.
Okay.
Whatever you think is your idea. Here's. Guys, come in here, and you could just sit down. You're welcome. Your new cute little baby. I'm so glad the vitro worked for you. Your baby looks really healthy, and I'm really happy for you guys. So, is there any questions that you'd like to ask?
Before you go, I think, does she have to get shot before she's born?
Well, she already is healthy and already is born, but she does have to have her baby shots, but that's not for until she's 2 months. So I'm so glad in vitro worked for you. Is there any other questions? Okay. Well, you guys just sit tight and wait for the doctor, and I'll be back.